Hi, everybody. Welcome to today's webinar. We are so glad to have the folks from CLASP to talk about their great report that they put together. I am Michelle Adkins. I am from the Build Initiative, and we are very pleased to host these great subject matter experts to talk to us today about putting the pieces together for families with young children. So I am going to pass it on to you, Elizabeth.
There we go. Thank you so much for having me, and thank you everyone for taking the time out of your busy days to join us this afternoon. Really excited about our guests. I won't talk too much, but I did just want to make sure everyone understood that this report came about because we were thinking about the fact that because policymakers have recognized the importance of the first years of life, we have, perhaps more than for any other population, a list of different programs that reach this population, from childcare, healthcare, nutrition, paid leave programs, but they're often operated quite separately and disconnected, which means that parents who are seeking assistance for more than one program really have to navigate a maze to put the pieces together. So we spoke with administrators, advocates, parents from 3 states that have paid family leave programs, because we don't have a national program yet, and then have other programs, and really talk to them about what they were doing to improve and to make the system work better, where they saw the opportunities, where the challenges were. So in a minute, we're going to hear from some terrific administrators about their experience. But first, to get us started, my colleague Alyssa Fortner is going to interview a parent about what is her experience with the system. And she is one of the experts who we did talk with as we prepared this report. So with that, I'll hand it to Alyssa.
Thank you so much, Elizabeth. Yes, we have been so lucky to have been able to have personal conversations and interviews with all of our panelists here today during the process of writing this report. And we're so happy to have some of them continue to work with us on this and be in our webinar today. I just want to start by saying we did originally have 2 parents with us today in this panel, but one, Charisse Rhodes, has had to step away to deal with a family emergency. So it'll just be Unique and I here today, but I'm very excited to have this conversation and get to speak with someone as wonderful as Unique. So I just want to give all of you some background about her. Unique Robinson champions the invisible struggle. Many of us imagine the middle class as a picture of stability. Unique, as a parent leader, is committed to shedding light on a hidden reality. So I just want everyone to join me in welcoming her and how much of a passionate advocate she is for families who are facing the struggle of disconnected services. So in her time, she is the president of a nonprofit organization called Mama Be Brilliant, and serves on the governing council of UPlan, who is the United Parent Leaders Action Network. So a membership organization, overarching, who has state membership organizations, and they develop leaders and parent advocates to bring their voice into the early childhood education space. But in addition, Unique is not just a dedicated leader in this space. She is a mother with a powerful story, and 9 years ago, she opened up her heart and home to her orphan nephew. And while state services provided childcare support during her fostering journey, the safety net vanished once adoption was finalized. So Unique suddenly found herself facing the harsh truth: the system she relied on didn't see her need. So this experience has sparked a fire in her, and she is on a mission to empower the forgotten about middle class, and the families who are struggling to afford basic necessities for their children. This is especially true today with rising inflation and an ever-increasing cost of living crisis. So many people are without the support they desperately need. So she is here to bring awareness. She is here to share her story, and she is here to help motivate those who have the power to make some changes, make them, And she really wants to change the way we view the haves and have-nots, exposing the silent struggles that many families are facing. So again, I'm happy to be here with her, a champion for the underserved and a voice for a community yearning to be seen. So thank you so much for being here. And now we're going to kick off with our first question. So can you tell us a little bit about yourself and your family? What services for families with young children have you had experience with?
Thank you so much, Alyssa, for that amazing intro. I really appreciate it. My experience, as you all heard, has been a little unconventional. So my nephew was orphaned to the state of Washington, and I, of course, reside in California. And so I had to go through the process of receiving him into my care, and that started with being a foster parent. So being a foster parent, I was able to receive services that were around childcare and other necessities that were able to help me to support him fully. And that was amazing and great. And although it was a great experience, even just becoming a foster parent was in itself very hard. I had to go through interviews. They interviewed several friends and family of mine to make sure I was a good fit, although I was his family member. But it was just a year-long process, even for me to come into being a foster parent. And from there, coordinating services from Washington to California, I wasn't aware of the nuances of the difference if I go through the process fully in Washington State, or if I, just transfer everything to California. I had no idea. The care worker was just really had a heavy workload. So she was just trying to push it through and had someone who was there to take care of him, and she wanted to get it off of her plate as far as a caseload. And so we kind of rushed through the process, and there were some unfortunate benefits that I missed out on because I didn't realize the difference in what it meant to fully adopt him in Washington versus adopting him in California, which I went through the full process of adopting him in Washington State. And so in that process had ability to have childcare services. And that's what I was, that's my whole story is about, is having access to the childcare services, which in itself, which I'll get into later, was going through that process was so hard, but I'll get into that process in our later questions. But it was a great service that was afforded to me, but I went through a lot of hoops and a lot of just challenging times to even just get those services for us, so we can do our best to make sure he got his services met, and I was able to care for him properly.
Thank you so much for sharing that. I want to ask a follow-up, but I know we're probably gonna get to it in our second question. So I'm just gonna move us along. So you have talked about how you were trying to access childcare. So if you had to pick a word to describe your overarching experience in accessing childcare, what would it be, and kind of what is some more context or detail into why you chose the word that you chose?
So the word that I would choose for my experience and how I was made to feel throughout this process was debilitating. I felt weak. I felt helpless. I felt lost. The paperwork was so hard to understand. And I have a college degree, but it was very challenging to navigate through some of the questions I had to answer, the stuff I had to provide. It was very confusing. And at times I just felt helpless. And then I had to, provide so much information, documentation, about my living expenses, taxes, so much I had to provide just to even, showcase that I had a need. And if I was missing one document, the process starts over again. And I found myself having to miss so much time from work because the option was to either send the paperwork in person or to mail it. And I didn't feel comfortable with mailing sensitive information in the mail like that. So I had to take off work a lot of the time to go and have an appointment. And God forbid something was wrong or I didn't have it right, it would start all over again. And I know to the caseworkers, they were doing their very best, but for me, it was so time inclusive and not being clear about certain things. And sometimes it would be the caseload was so heavy, it wasn't that they were trying to be mean or dismissive, but it was just like, you have to do this, you didn't do that, okay, then you have to do this. It was just like kind of sending me all over the place. And I just felt like, oh my gosh, like, this is impossible to get through. Like, I can't even imagine other people who don't have the ability to take time off work, or who, don't have access to really read through all this paperwork on information and really get to the bottom of it. So for me, I just felt so helpless, so alone, and I felt like the system was actually working against me rather than helping me. And it just left me feeling in a very debilitated state, to where I felt so helpless. And yeah, it made it very challenging for me.
So I want to ask a follow-up of how difficult was it to even access all of the required documentation and information you need? Like, did it all feel like it was even necessary? I know we hear a lot that there's some repetitive documentation, there's repetitive these things, and like you said, if you miss something, it feels like you're starting completely over. So do you just have any more detail you can provide just about like how proving your situation and yourself, like how that went?
Yeah, it was the documentation I felt sometimes were an overkill in the level of information they required from me. Just even to just approve my identity. I'm like, okay, you need a birth certificate? Like, I don't know where that thing is. I have to order it. I have to do all this stuff to even prove I am who I am. Having all the information, access to my taxes, to all of my debt, all this stuff. I'm just like if I didn't need it, I wouldn't be here. Like, and I know that there's people who, unfortunately have, exploited the system and things of that sort, but it's made it really challenging for people who just really need the support, to have to go through all of these hoops and provide all of these documentation that people don't have sometimes readily available to them. And I had to order a lot of stuff and then wait for that to come in the mail, and then go drive down again. And it was just, and then on top of that, it was finding even providers that were able to qualify to get the services. That was a whole nother thing in itself. Like, I couldn't find any providers that can, meet that threshold with that was covered. And so for me, I was lucky enough that the elementary school had a adjacent childcare provider, and I was able, I had known them. I was able to get help, and they gave me a scholarship to offset the cost. But most people don't have that option. It's either, the providers within the network or approved, and it meets the qualifications from a investment standpoint. If not, they have to find somewhere else. And I took a lot of time off work too, looking for providers in the area. So it was just a lot that went into this process. And again, some people don't have access to getting a scholarship or getting assistance in addition to the assistance they're already getting from the state. I was just fortunate to be that person to do that. And when I went through the full adoption, and that it was a complete shocker, because I had no idea that once I got adoption approved, they were no longer going by my son's income. They're going by my income and my need. And so if I didn't meet the medium, which is why I'm so passionate about the middle class, that income medium is just totally outdated, because what I have on paper as far as my income is not what I take home. And it's not even taking into effect the cost of living in my area, and for a 2-bedroom, in my area is $3,800. I can't afford that with the salary I make, although I do make 6 figures, but I don't bring that home, and I can't afford that kind of rent. So for me, I had to make a choice. Do I get a 2-bedroom and just struggle to even get food on the table? Or do I get a 1-bedroom? He has the room and I sleep in the living room. That's what my choice has been for the past 9 years. I have occupied the living room space as my room, and he has had the room. But people would think that because I'm in this income bracket that I don't have any need. And that's just so far from the truth. I can't even begin to tell you.
Yes, thank you so much for sharing this and being transparent. I'm gonna hit you with one more
Okay.
kind of offshoot of a question here. I know we, as we should, really focus on the impact on parents, on guardians. But I'm curious if you could share it all, kind of like what do the problems in our services for young children, like what impact does it have on the children themselves. So I think I'm curious, like, while you were looking for a provider, was the foster care system providing some sort of care for you in the meantime? Was your son without care? Just kind of, like, what stress do you have that, translates to the child as well? And how can we support child well-being, I think is what I'm kind of getting to the idea of.
Yeah. So in my instance, in going through the process and waiting and getting approved, for the most part, he went without care. And I had to lean on friends and family. And that was hard because everyone's working, right? And so once he got out of school, it was like, oh gosh, what do I do? And so I ended up doing a GoFundMe to raise money to help with some of those costs, which one, I never thought I would be doing that to raise money for childcare, but people in my community, they galvanized behind me and supported me, and they gave to the GoFundMe to help me to be able to offset and help with some of the costs. But especially as he gotten older, and that's a whole other thing. Once you get a certain age, they think you don't need childcare. It's like, no. What do you do with a 11, 12-year-old? They need to have someone watching them and supervising them. But when he got of that age, unfortunately, it was just no care. And so I worked out something with my employer to work hybrid sometimes. I work from home. And so that way I can be home with him, or I would leave early once it was after school hours, and I could work from home the remaining of the time. But I just was fortunate to get some people having some grace and leniency with my work schedule. But other than that, it was no care.
Yeah, and I'm so happy your community, stood behind you and supported you and you had a flexible worker. But as you've mentioned before, like, this is not the reality for most people. And where are we that we're having to have GoFundMes to ensure that, like, our children have what they need? And so um the bittersweet of, I'm like very happy to, like, hear how it worked out for you, but that should not even have to be a reality that we're seeing. So just thank you so much for sharing that and for entertaining some of my side questions. But I think you shared a lot of great information. And we're getting a pretty active chat, by the way. I don't know if you see it. Both of us.
I can see you popping up, but I can't see what they're saying, but I'm so happy for the work that you all are doing and bringing this to light, because I think it's something that needs to be spotlighted, because there's so many families like myself who are challenged to meet their bare necessities. They're not asking for anything fancy. I'm just asking for be able to, properly afford housing, be able to afford groceries. Rising cost of groceries is crazy right now, and if there's an enrichment, like if he needs tutoring, like my nephew had a lot of trauma. He was in the system for 7 years and had a lot of trauma. So I had to do a lot of things with mental health. And that was a whole other thing for mental health access. And there were things that he didn't, in his formative years, didn't have access to certain learning. So we have tutoring for him. And so that's why I'm so passionate about Mom Be Brilliant today, because Mom Be Brilliant is able to bring resources and support to offset some of the things the moms don't have access to, or resources to really help raise brilliant children the best way they can, and having a full round solution across the board. So I'm so happy you all are bringing this to the forefront and really highlighting the need that is persistent in our society. So thank you.
Yes, and thank you so much for being here and sharing your full truth. And just to all our participants, Elizabeth did put in the Mama Be Brilliant website in the chat. If you have not seen it, please go and look at all the work Unique is doing. But I want to, we've kind of already got.
Can I just interject for a second?
Yeah, for sure.
There's a question in the question and answer, and I think Unique is the only one who can answer it, which is, how were you able to take care of yourself through all of this, through the stress and the repetitive requests and all that you have been through?
If I'm being totally transparent, I wasn't taking care of myself. I was on autopilot mode, zombie mode. I was just barely existing. I was going through an extreme amount of depression. Sorry, because I don't have any children of my own, and me taking on my nephew's son as I call him now, it was a lot. It was hard. I was doing parenting for the first time, and to have that on top of trying to parent kid with trauma, a kid in the system. I didn't take care of myself. It was very hard.
Yeah, thank you so much for answering, Unique. Again, showing up, being honest. And I think something to highlight here is that like these systems are not just about whatever specific service that they're offering, right? Like it's not just about childcare. It's about whole family well-being. A child being in childcare supports their development, but it also supports the development of their families, of their parents, of their guardians to be able to have the time to do your responsibilities, your education, your career. And so I think just continuing to highlight that, you know, these services mean so much more to families, and having a disconnected system, having broken programs on their own, even outside of the system, like does impact so many members as a family. Because also, as Unique was sharing, you have to rely in childcare, we're relying on our family, you know, family, friend, and neighbor childcare. And like that's an impact on people who are not even part of your direct family of having to take on that responsibility. So I think just continuing to uplift the wide spread benefits of these programs, regardless if it's childcare, paid leave, SNAP, whatever it may be, of just it's about the whole family and that everyone should be supported and have what they need to thrive. And so I just thank you, Unique, for sharing that and for helping us, you know, get to this, I think, really vital point to
I
these.
see one more question in the Q&A that I'm going to ask you, Unique, if that's okay. And then you should definitely, once we start talking to the other panel, you should read the chat because people are saying really lovely things to you, and you should take the moment to sit with that. But we do have a question from Colleen Robinson about what types of support would have been most impactful for you during the process.
Type of support would have been just making it easier to get access to the childcare, you know, and making the paperwork just more, you know, streamlined and easy to understand. That would have been, you know, extremely helpful. And being able to, you know, the provider list was, it was massive, you know, so helping me to, you know, kind of drill down on, you know, the care for him would have been, you know, would have been very helpful. And then having additional resources to help with additional costs, like his mental health. Like it was so hard to get mental health assistance for him in those very, you know, hard times in the beginning. So having, you know, easier access to mental health providers and stipends and resources that cover them, because even what was offered through the state, it didn't cover most of the therapists in my area for him. So that would have been very helpful to have those things that just would have helped the transition as as I came into motherhood, as he became my son, much more manageable for us.
Thank you so much for sharing your story with us. And lots of people in the chat are thanking you as well. It is really critical as we wrestle with these policy issues to talk to actual families and parents and caregivers and who are dealing with it, and who can share their real lived expertise. So thank you.
Yes, exactly. And thank you so much for answering this and being transparent. Just before I turn it over to Elizabeth, is there anything else before our time ends for this panel, Unique, that like as we go into our panel with our administrators, is there just anything else you would want them to know, or other state folks who are on this call? Is there just anything from being a parent that you think maybe they haven't heard or that they miss?
Yeah, I think the income median needs to be reevaluated, and what need looks like needs to be evaluated. I think it should really encompass the entire full spectrum of what it takes to manage the household, from housing to electricity, gas, like all of that should be accounted for when you're looking at someone's need. So I think that that needs to be, it's a gross oversight in my opinion to not have the income median reflect what's actually happening within our society as inflation and housing costs continue to rise to a point that's unbearable and suffocating. So I think that reevaluating what it means to have need. And that's why I'm so passionate about supporting this unforgotten demographic of moms in the middle who make a certain income. I think that it just needs to be a wider understanding of what need looks like based on where the person is located and the costs are associated with basic necessities.
Yes, that is a
you.
great point, especially the financial burden that many people in this country are facing. So thank you so much for being here with us today, for engaging in this panel with me. And yes, please go read the chat, Unique. Thank you so much for everything. This has been a wonderful conversation, and just thank you for being here, for showing up and being your most true self.
Thank you.
So I'll turn it over to you, Elizabeth.
Sure. I think our partners are we're switching the spotlight so you can see our wonderful state administrators who have graciously agreed to join us. I will do brief introductions and then jump right in. So Babs Roberts serves as the director for the Community Services Division within the Economic Services Administration of the Department of Social and Health Services in Washington State. And I'm not going to do the alphabet soup of all the programs that she's responsible for administering, but she is a lot of them and has been with Washington State for more than 30 years of experience, and also works with other TANF administrators across the country who are trying to figure out how to make cash assistance work better. And Melissa Stone is with the California Department. Hang on, I need to switch windows. I can't multitask quite as well as I thought I did. But with the EDD, it's you're going to tell me what the acronym is. I'm sorry.
I'll help you out. Sure. So it's the California Employment Development Department, and I specifically oversee the disability and paid family leave programs. So the paid family and medical leave is what most states call it for the state of California.
Thank you. And I will say, when I was looking for Melissa's bio, I looked at her LinkedIn page, and she's got these great values lifted up of people first and accountability and providing a positive customer experience, process improvement, and psychological safety in teams. So like all the things that we want to be lifting up today. And I'm really excited to have folks from states that have been the leaders in this work, but also recognizing that even in these states, there's still lots of work to be done. And then in particular, sort of paid family leave is often like way out on one side, and childcare and the other benefit programs over in like a completely different universe, even though it's often the same families who are accessing both. So why don't, with that, I just ask each of you to talk a little bit about what you've been working on recently in this space, what you're really excited about, and we'll go from there. Why don't I go to Babs first, please?
Sure. Yeah, no, happy to do that. And first, I just really appreciate Unique's unique perspective and loved her honesty, her transparency. The systems aren't designed well, right? I think we can all agree that the systems aren't designed well, that the systems many people rely on are broken to a great extent, and there's a lot of work to do to fix them. And I'm very excited to talk about some of the work that's happening in Washington, and I'll be really brief. But I do want to say that work starts with listening. And listening not just to the portions of the system or the people that are sort of running those systems, but really and meaningfully listening to the voices of the people that are most impacted by the systems we work. The people that are getting these services that we deserve to give really great service to, but also to the people who are on the front lines trying to deliver these services, who know where the broken spaces are. And if we can really start from that perspective, we can do some real work. And this is part of what Washington did in its work to really meaningfully develop a 10-year plan about how we would reduce injustice and poverty in Washington State. There there are 8 strategies in that. I could go on for decades about how we got there, et cetera. But the one I want to focus on, I think is meaningful here, Elizabeth, is the strategy 6 of that plan, which is to really focus on streamlining and integrating the systems that help lift people out of poverty, help lift themselves out of poverty. And that is a strategy we've really been focused on in a couple of different ways in Washington. One of them is really looking at the opportunity that unrestricted cash benefits can give to folks. By not putting parameters and work requirements, et cetera, around cash, we give people a chance to really use the assistance we give them in the way that best fits their needs. And I think working towards doing something around that is really important. But integrating systems is the place where I really think we have been focusing on. And we have our integrated eligibility and enrollment project, which is a coalition of 5 or 6 agencies that are doing some level of human services. So that's childcare, and that's all of the medical or Medicaid types of programs, please, and there are a plethora of those, but food and cash assistance, long-term care services, and all of those other places where the systems really need to come together and talk to each other. So doing some of that work. And just recognizing that Washington is also doing a lot of this in an aging mainframe system that was, 20 years old when we bought it 30 years ago. So it's really, the systems are hard to work with. But that work has started, right? We're, about to launch the first product, which is a sort of self-service application tracker system that would allow for clients to understand where they are in the system, what's happening with their paperwork potentially, et cetera. And that's really cool. But we've also been doing some really great work with Sevilla and Benefit Data Trust around setting a foundation. And by that, I mean real deep analysis of policy alignment and misalignment. Where do all of these programs, Medicaid funded through CMS, food funded through USDA, refugee programs funded through OR, cash programs funded through a plethora of places, where do all of those rules have alignment and misalignment? And more than that, where is that misalignment a perception states have versus a reality of the federal government rules, right? And really doing that analysis first was a big part of that. And then taking that analysis and leveraging that to really develop prototypes for applications that to some degree will eliminate some of the duplication. One of the things we heard very clearly from our steering committee, a steering committee we did in our poverty work that is wholly people with lived experience. One of the things we heard consistently from them is stop re-traumatizing us. I don't want to tell every agency my story again. I don't want to have to give you all the same income information and all the same demographic information. And why are you asking me this question this way when they ask me that question that way, right? I mean, I see Unique is smiling. She's been there, right? She understands, right? So doing that work and really drafting a prototype of an application that would take the common questions across what are 4 or 5 different applications for different programs and putting them in one application to get to the financial eligibility. This is your financial situation. And then allowing a family to do a supplement for the programs they choose to apply for. Rather than trying to take every program into one application and say, you answer all these questions, even if you don't want or need long-term care services, right? We don't want to do that. We want to make this easier for people. So been doing some of that work since we talked last year, Elizabeth, and really trying to get down to the heart of what is it really going to help families access the system. And then working really hard to find ways to increase. And I think Washington does a good job of electronic verification. So you tell me, we'll go verify it for you. Like, let's go out and find that information for you. I don't need you to give me a wage stub because I can get that from the UI system, the unemployment system, or I can get that from Equifax, right? I don't need you to bring me a birth certificate for a child in your home because I can access vital records in the Department of Health. I don't need you to tell me the value of your car because I can go out to the Department of Licensing myself and see that, right? we can do a lot of this for people and should be. I'm probably well over my time.
I have lots of follow-up questions, but I'm gonna let Melissa get in and talk about what they've been working on, and then we can ask more questions and also maybe have some back and forth about sharing notes.
Thank you. And I also want to acknowledge and recognize Unique's story. Living in California and being a government employee in California, I take it to heart, and actually went through use of benefits myself as a young mom. And I can tell you that my experience was so poor, this was close to 20 years ago, that I didn't actually tell anyone the story about my use of a safety net benefit program until about a year ago. So I really take that to heart, and know that feeling, like when you're tearing up, I'm like, I remember that. I remember feeling shameful for using benefits. And that's something that now being in a position where I can affect change is, I hope to use that to inspire my teams. I hope to use that to bring that humanity with my teams. And the one thing that I will say, and I hear it in what Babs is saying too, I think in government, we have a lot of good people who really care, who resonate with the missions of the organizations, stuck in bad processes with outdated systems. And so one of the things that we are really focusing on at EDD, my department, Employment Development Department, I'm going to try to not use acronyms, is we are doing a full, what we call a customer-centric transformation. So we've kicked off what we call our EDD Next project, and it's really looking at every aspect of our organization, from how individuals apply for benefits, how they interact with us, how they get their money once they've received benefits, how we connect to other organizations. So we're really trying to look at every aspect of our culture, look at our systems, look at our forms, and we're doing that. When I say we are looking at them, we are really trying to co-create that with customer feedback. So appreciated what Babs was saying. I saw some great comments in the chat about listening. We really have, before we even started the technology project, we had the opportunity as a department to sit down with our stakeholders. We have a wonderful advocate community who really partners with us to help us understand some lesser represented claimant populations. We had actual claimants who came in and walked with us through it. We talked with our front line. So really trying to get that 360-degree view of what's happening right now to truly understand where our challenges are. We know we have challenges. That's, we have no shortage of challenges. But we have, as I said, we have good people who want to do better, and we recognize that we can do a lot better going forward for claimants. So for us, we typically are supporting, related to parents with young children, we're supporting families as they welcome new children into their home, either through birth or through a foster or adoption placement. We offer leave that supports all of those family situations. We also support family members that have a military deployment. If a parent needs to take time off work to care for a sick or injured child, even as Unique's talking, I was like, oh, and even if they need mental health services and you need to take time off to do that, those are the types of things that California supports. One of the challenges, though, and I think we're talking about gaps here, is individuals even knowing that they qualify for this. So we have done a lot over the past few years with marketing the program. It's always a challenge that, we're marketing to people, trying to bring awareness so that when they have a life event, they know where to turn, they know what options are available to them. So I think for us, it's a matter of bringing awareness to the programs, improving the accessibility of the programs. Some of that's language access. California is a very, very diverse state. So just having services in English and Spanish does not help reach all communities. So we really are looking at increasing language access. We're looking at increasing channels that customers can come through so that we're meeting people where their need is. Simplifying our application, to Bab's point about how difficult the applications can be. So by sitting down with individuals and looking at, okay, let's walk through the application, talk to us in your terms. What do you see? Does this make sense to you? Does this, and even our front lines, they know a lot of the common errors customers make. And I appreciated some of the wording that I think it was Unique used, that we don't want to get into that blame game with our customers that, well, you filled out the form wrong, or you should have done this because excuse me, let me back up. So one of the things that we try to stress with our staff is when those situations come up, that's an issue in our process. So how do we take that feedback and apply it to improve our processes? It's we move at the speed of government. So we have a lot of really good things in the works that that over the next 5 years, I think we'll see some really exciting transformations with our programs. One other thing I think is exciting that we've spoken a little bit about income related to these situations. We have the blessing of being under an administration that really supports our program, that really supports families, and is doing a lot to further the support California can offer through the disability and paid family leave programs. Starting next year, our wage replacement rates are going up significantly. So currently in California, if you're off work for disability or paid family leave, you get 60 to 70% of your wages. Starting next year, it'll be 70 to 90%. So that's really going to be a huge jump in hopefully those that are able to take that time, meaning you can afford to take that time to be with your loved ones, be with a new baby, be with a new foster child, really come alongside them and provide that care that they need to have. And one more thing, I don't want to go over my time either. One thing that I'm excited about that we're doing is really trying to work with other entities. We're working with, and these are all things that are in the works right now, but we're working with Department of Healthcare Services, who administers our Medi-Cal program, to look at how we can support families with new babies, to better transition between the programs, or better coordination just of awareness, as well as our California Civil Rights Department that administers our job protection. So there's often confusion between FMLA, the Job Protection Act, and then paid family leave, which is what we administer. But how do we create a better bridge or handoff of claimants to, even if we can't answer their questions, if we can help point them to the right department? California is massive. I couldn't even tell you all the departments within California. So just trying to find better ways to coordinate between us. There also was a pilot program done a year or so ago where looking at the end of our applications, suggesting other California services that may be available to the individual, to make them known. You may qualify for earned income tax credit through the Franchise Tax Board. So here's a link to that. Or you might qualify for Medi-Cal. Here's a link to that. So just, looking at the situation and trying to offer those things up, at least as a pathway for them to get more information. So I'll pause there. Happy to answer anything more.
And thank you both very much. And this is really exciting and positive work, although it is a reminder that it's a long process, that we can't just flip the switch and fix everything overnight. I guess I'd love to hear from both of you. So what advice do you have for another state or locality that's maybe just starting the efforts, and maybe where some of the IT stuff feels further off, but what are some of the things that can be done, without completely rebuilding your online application, to improve the handoffs and improve awareness?
I can go first this time if you want, Babs. So I would say, and I'd kind of put together my talking points ahead of time, so it's funny how much we're talking about this. Start with listening. Start with your end customer. What are you trying to achieve? What is that desired outcome for your customer, and what's your desired experience for your customer? And then build to that. And I think historically, government has built from policy to requirements, which becomes, we check, it can feel like we check the boxes, that we get it through, but it doesn't feel like a good customer experience for the person who's using those benefits. How do we create a system where people feel valued and cared about? They feel like we're partnering with them to build to those, build to that outcome. It's really a different spin that I think is permeating government now, and we're all reorienting ourselves, but working from old systems forward. So anyone who was going to start new, I would kind of ask those hard questions up front of how we could build better solutions, not just check the boxes that we got, you know, we put the policy into play. Just a different spin today.
I would say yes to all of that. I think first, really, to get to the question of what advice I'd give to other states is you really, and I cannot emphasize this enough, you have to have a North Star, and you have to build that North Star. Like, where are we trying to go? And you have to build that North Star with the people that you're serving. And when I talked about the poverty reduction plan in Washington State, this 10-year plan, and I talk about the steering committee that is made up completely of people with lived experience, and not just prior lived experience, but people currently on our programs who are experiencing it right now and dealing with it right now. And being intentional about calling them a steering committee, not just calling them a steering committee, but committing that nothing went into that plan that didn't include their voice, that wasn't approved by them, that they didn't say was a priority. And that everything we did with that steering committee included supporting them with resources to develop their own ideas and to put those in our plan in a way that could be heard and meaningful to policymakers, right? That has to be the start of how you fix this system, is the people who are living this work, and really meaningfully hear it. And I have to say this because I think it's really, really, really vital. I remember sitting in these rooms and a co-chair of the steering committee coming in, and we were talking about some really important stuff around understanding the historical and systemic racism that exists in the policies of federal government and state government, right? It's sitting there. And all this really important, very strategic, very sort of big picture idealism. And I remember this co-chair of the steering committee coming in, and he's saying, this is so meaningful to me as a Black man with raising Black sons, that this is important to me, that we change this system, that we are focused on equity. He said, but you know what? My kids are hungry today. What are we doing today? What are we doing right now to fix some of this? And he really, having that voice really gives you an idea that you can't keep going with, here's the big, long strategic plan. It's got to have some meat right now. We've got to do what we can with the systems that we have and do that work. So that having that North Star is really important. Getting that buy-in from people is really important, but doing something is really important as well. I think you really have to take what you can and move forward, take those steps. I think it's super, super important that you not get stuck waiting for perfect.
Well said. And I want to add one more thing, if that's okay, Elizabeth. One other thing, I think, we both talked about outdated technology, and I think we're in a different state of the world today with technology. That a new state, I would say, get a system that's quickly scalable, because we have been, we're still working off very, very outdated systems and trying to make incremental enhancements versus having a scalable system that can work with us. So for us, as we're doing our transformation, we're really trying to look at that as we're bringing on new systems, new technologies, that they're not things that are going to be outdated by the time they're implemented 3 years later. That they're things that are going to grow and evolve with us in a way that can handle the increasing needs and demands and changing needs and demands of our claimants, because the world changes, right? It's not the same from one year to the next. We deal with things in 2024 that in 2019 we wouldn't have even considered that we would deal with as a program. So it's just, that ability to move at the speed of society today, so that you truly can meet the current needs of the claimants and not needs of 3 to 10 years ago of claimants.
Right. Bonnie McKenzie has her hand up, it looks like, and also made a comment in the chat. I don't know if you wanted to try to jump in and say something out loud to everyone. I will just, the comment looks like a compliment to California EDD, that it was a little confusing, but she did get someone calling her when she sent in a question. So that's certainly a nice thing to hear. Well, Let me just call it unique. I don't know if you have anything that you wanted to ask of our agency panelists while you've got them as a captive audience.
I'm not sure if it's appropriate, but I could just ask it. So from an EDD standpoint and paid family leave, I know for me, when I did take the leave for the child, was it bonding leave through my job, it was challenging for me because of the amount that I was given wasn't my complete salary. So is there something being done to kind of help support families when they want to do bonding time to where, you know, they're not having to be in a disadvantage from a resource standpoint by taking this time because they're not getting their full, you know, paycheck?
Thanks for the question, Unique. Yeah, so that's the bill that I was referring to. So starting next year, wage replacement rates are going up significantly. So right now, if you were to take bonding, you would get 60 to 70% of your income based on which, if you fall into low income, you get 70%. If you are above that, you get 60%. And starting next year, that'll be 90% for low income and 70%. So it's an improvement in the right direction. And it's always important to keep in mind when we talk about disability that the disability wages aren't taxed. So when we say 90% of your income, you probably are receiving right in line with what your paycheck would be, because you wouldn't be taxed on the amount that you're receiving versus your regular check has taxes. So you know, what you ends up in your bank account is about the same.
Okay, thank you for that.
Yeah.
So one question I had, and maybe Babs, I know, you know, thought about this, so is, you know, thinking about folks in the other Washington, DC, and how what policymakers at this end can be doing to make these system integrations more possible. Obviously, there's lots of steps between policymakers in Washington, and these programs are largely administered at the state and county level. So if you have things that you'd suggest to the folks in DC, would love to hear them.
Yeah, I don't think anything I'm about to say is new. So I don't have any new innovative ideas for the federal government. I do think that they should do more to help with alignment, right? With that alignment we talked about, or that misalignment. And I just have to be like really open about this, is like, when we're talking about federal rules and federal statutes, CFR, Code of Federal Regulation, this is a congressional action that has to be taken in some cases, right? And I think about, for instance, something that seems really simple. In the SNAP program, there is a prohibition in the federal regulations that is not waivable by USDA that says you cannot share SNAP participant level data for any other reason other than the purposes of the SNAP program. So that means that we couldn't share, and I know this because I've been told no, that we can't share SNAP participant information with our Department of Revenue, who issues the working family tax credit for purposes of easing people's access to that tax credit. Because it's not a SNAP purpose, but it would be super beneficial for those working families to get that $1,200 a year. The rules just don't let us sometimes make it simple. And how can the federal government help us push some of these things that are just archaic things?
So one thing I'm going to lift up that is not, I guess, a question, but maybe both your states have gotten waivers to do multi-year continuous Medicaid eligibility for children, which means that once parents go through the paperwork, they don't have to do it again until the kids are, you know, school age. So I'm just wondering if either of you have comments on what that's going to mean for parents and how it's going to affect your processes and all.
Yeah. I mean, I would say, and Medicaid's sort of outside my realm, but the idea, the concept that A parent's not going to have to renew their application or their benefit eligibility annually for their child. It's one of the easiest ways we can simplify this program, right? Children have a right to adequate health care. If we want children to grow up and be, what everybody talks about, responsible adults, we have to give them a healthy foundation. I want to see something like that for food assistance, frankly, and for childcare assistance, continuous eligibility for the length of some period of time. It just makes sense that we're giving kids a foundation. We want their brains to develop. We want their bodies to develop appropriately and healthy so they have the best chance. All of those programs are going to be beneficial if we can push them along.
So I'm not seeing, I think I'm just double checking the Q&A. I think Unique is answering the question that's open. Maybe I'll just say thank you, and both for taking the time out of your very busy schedules to join us today, but also more for the work that you're doing to make these programs really work for families in your states. And I will hand it back to Michelle to wrap this up and maybe talk a little bit more about Build. And also, again, thank you to Unique for sharing your story, which was really powerful. Thank you.
Yes, thank you all so much for being here today. I am going to just close us out real quickly. The contact information for Elizabeth and Alyssa are on the screen now. So if you would like further information, I'm going to just say, feel free to contact them. The other thing is that when the webinar closes, there's going to be a survey that pops up. So if there are questions that you think of, that you didn't think of during the webinar and you want further information, or you'd like someone to contact you, there is a place in that survey for you to put that into the form. So please go ahead and do that. I will share that with the panelists, and we will get those questions answered for you. My final words are about the prenatal to 3 capacity building hub, the exchange. We invite you to join the exchange today. It is a group of over 3,200, I think was the last number I heard, of experts and implementers and providers and policymakers who are all focused on the prenatal to 3 arena. And you can post sources, you can ask questions, you can meet up with other people of like minds. And it's just a great place to come and meet up and share your information. There is 27 members. I think we do have to update that slide. I think it's actually 3,200. So please, if you're not a member of the exchange, we invite you to join us. I think it's just www.exchange.org, but we will get that to you if that's not the right URL. So thank you so much for being with us today. Thank you very much to the panelists. This was a very informative webinar, as you could see by the activity in the chat. So thank you all very much. We appreciate you spending your time with us today, and we'll see you next time.